Hello, my name is Veronica Fortune, BRANDMAN University students, DMP students at BRANDMAN University. This presentation is in 4 parts, and this is part 1 of video 4 session of NURU 642 Psychotherapy Didactic Signature Assignment Integrative Therapy video. I will be discussing 3 different therapy modalities to be integrated for best patient outcome. According to the Institute of integrative psychotherapy embraces an attitude towards the practice of psychotherapy that affirms the inherent value of each individual. It is a unifying psychotherapy that responds appropriately and effectively to the person at the effective behavioral, cognitive, and psychological levels of functioning, and addresses as well the spiritual aspects of life. Within this framework, it is recognized that integration is a process to which therapies also need to commit themselves. The 3 modalities that I have chosen to use with my patient in this presentation are cognitive behavioral therapy, known as CBT, dialectical behavioral therapy, DBT, and acceptance and commitment therapy, ACT. I would then summarize each therapy by identifying the key concepts. Number 1, cognitive behavioral therapy. CBT was founded by psychiatrist Aaron Beck in the 1960s, following his disillusionment with Freudian psychoanalysis and a desire to explore more empirical forms of therapy. CBT is a form of psychotherapy that focuses on modifying dysfunctional emotions, behaviors, and thoughts by interrogating and uprooting negative or irrational beliefs. CBT rests on the idea that thoughts and perceptions influence behavior. CBT aims to identify harmful thoughts, assess whether they are an accurate depiction of reality, and if they are not, employ strategies to challenge and overcome them. 5 common CBT techniques. Socratic questioning allows for self-awareness. Homework, self-monitoring, behavioral experiment, systematic desensitization. Next therapy modality is dialectical behavioral therapy, DBT. DBT is a specific type of cognitive behavioral therapy developed in the late 1980s by Marshall M. Lehern to help better treat borderline personality disorder. Since its development, it has also been used to treat other kinds of mental health illness. DBT is a type of psychotherapy or talk therapy that utilizes a cognitive behavioral approach. DBT emphasizes the psychosocial aspect of treatment. Components of DBT: support-oriented. It helps a person identify their strengths and builds on them so that the person can feel better about him, herself, and their life. Cognitive-based. DBT helps identify thoughts, beliefs, and assumptions that make life harder. Collaborative. It requires constant attention to relationships between clients and staff. The 4 modalities of DBT: mindfulness, observe, describe, and participate; interpersonal effectiveness; distress tolerance, changing distressing events and circumstances; emotion regulation, learning to properly identify and label emotions, identify obstacles to changing emotions; reducing vulnerability to emotion, mind, increasing positive emotional events; increasing mindfulness to current emotions; taking opposite action; applying distress tolerance techniques. Next modality: acceptance and commitment therapy, ACT. ACT is an action-oriented approach to psychotherapy that stems from traditional behavior therapy and cognitive behavioral therapy. Clients learn to stop avoiding, denying, and struggling with their inner emotions and instead accept that these deeper feelings are appropriate responses to certain situations that should not prevent them from moving forward in their lives. With this understanding, clients begin to accept their issues and hardships and commit to making necessary changes in their behavior, regardless of what is going on in their lives and how they feel about it. All right, so we have come to the end of part 1 of the session. Part 2, The history of my client. Mr. Smith is a 71-year-old Caucasian male. He's been married for over 30 years now. Patient is being seen for anxiety and depression due to his diagnosis of Parkinson's disease. He's having a hard time adjusting to this disease. He's been diagnosed with Parkinson's disease for over 10 years and would like to remain as functional as he can. He's feeling guilty, thinking that his lifestyle and how he lived his life in the past might have contributed to him getting Parkinson's. So unfortunately, the disease is progressing, pushing him into depression, anxiety, and he's having difficulty adjusting. During our last session, Mr. Smith stated that he will often struggle with what he perceives as past mistakes or what financial situation he will be leaving behind for his family, which includes his wife and his 2 children. The following specific symptoms are reported by patient on his mental health progress monitoring tool scores: restlessness, keyed up, on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension. Overall symptom severity is moderate. He's fully oriented and his voice fluctuates due to Parkinson's. He's logical, he's coherent, he's well-mannered, cooperative. He denies any homicidal ideation, denies suicidal ideation. All right, for this client, CBT will be used to change ideas associated with the stressor, use of mindful strategies to reduce physical stress, and development of problem-solving strategies like guided imagery, stop thought technique. DBT, dialectical behavior therapy, will be utilized through mindfulness to assist the patient to be in the here and now, his feelings, and also the stop thought technique. And yesterday is gone, tomorrow is not here yet. And finally, acceptance and commitment therapy will be utilized to help the patient to introduce the sense that struggle and control may actually interfere with their everyday functioning in life aim attainment, and then explore that notion briefly in terms of patient's life experience by challenging the thought process. ACT will encourage this patient to embrace his thoughts and feelings rather than fighting or feeling guilty for them. ACT paired with mindfulness, incorporated in CBT, DBT through mindfulness-based therapy offers clinically effective treatment. This ends part 1 of this presentation. We are on part 2 of this presentation. The role of therapy is to go back to where we know, right? We're going to have a brief history of present illness and cognitive behavioral therapy. The last time Mr. Smith came for a session, he was struggling with guilt and blaming himself for having Parkinson's disease. Guilt of not being able to fulfill his duty as a dad, and he's starting to lose functionality with his legs, hands, increased shuffle gait, shaking, leading to anxiety. He's blaming himself for the lifestyle that he lived, probably drinking too much and smoking too much and other lifestyle, and he thinks that they might have contributed to his Parkinson's disease distorted thoughts, right? He was assigned a few exercise to help with anxiety, racing thoughts, guilt, and acceptance of his disease. At today's session, we'll see how he's doing and either continue with what is working or try something different. The therapy is expected to show some progress from the last meeting with this patient. How we're going to talk about how different cultures can benefit from this modalities. It should be noted that cognitive behavioral therapy is usable in all cultures. It relies on a person's own thought process. You don't have to challenge anyone's reality culturally. Dialectical behavioral therapy, DBT, looks at ways to challenge distorted beliefs for the positive, but different cultures view things differently. DBT has been implemented across the world in making it one of the few evidence-based psychological treatments with a truly global reach. ACT is more accepting of a person's mind. It doesn't challenge a person to rethink how they view things. Thus, it is relevant in the sociocultural construction of values and a potential connection between psychological flexibility and other states of consciousness in different cultures. Okay, here my patient just arrived. Hello, Mr. Smith. How are you?
I'm doing okay, man. How
You,
are you?
you are doing great. I am doing fine. Thank you for asking. So, my name is Veronica Fortu, and I am a psych mental health nurse practitioner, a student at BRANDMAN University. Do you understand and give consent for the session to be video and audio tape to be submitted to BRANDMAN University?
Yes, ma'am, I do.
Okay, so tell me, what brings you in today?
Well, man, as you know, since our last session, I'm still feeling very anxious because of my Parkinson's disease, and I'm worried about my family and finances.
What are you worried about?
Basically, I'm worried about not having enough money to take care of my family as my disease keeps getting worse.
Tell me about anything good that has happened to you throughout since the last time we separated. Has anything good? Have you thought about anything good?
Well, I've been thinking about engaging more with my family, trying to spend time with my kids, things that I've been held down, not been able to spend some time with my wife, well, due to the coronavirus, as we all know, we couldn't go out too much, but the little time that we have in the house, I try to engage them to the best of my ability.
Awesome. You talk so much about your family. Do you thrive when you have your family around?
Yes, ma'am.
Okay. So how is your wife coping with everything?
Well, my wife is very positive that things might get better, but on the other side, she too is very worried. She's worried moving forward that because I was the breadwinner of the family, she doesn't work. She's worried about finances and how the kids will cope. How we're gonna pay the bills. You know,
That's a valid worry. It's a valid worry. So guilt is something that you struggle with. You feel guilty that maybe because of how you lived your life in the past, it might have contributed to your disease.
absolutely, ma'am. In the past though, back in the days, I lived so much at the edge. Drugs and alcohol. These things keep playing in my mind. I'm thinking maybe because of my lifestyle, which is causing this.
Is there any evidence to show that your lifestyle contributed to your disease?
Well, I was heavy on drugs and alcohol, and I just believe it's something in my head. I just believe that could be the cause of what I'm going through.
What will your life look like if you were able to go past your guilt?
If I was able to go past my guilt, I'll be able to, my functionalities will increase. I'll be able to, take my kids to school, help them to do the assignments. I'll feel better inside, and feeling better inside will definitely show outside, and that will also increase my interaction not only with my family but with society in general.
What keeps the guilt around?
What keeps guilt around? That's a good question, man. Just looking at my kids and not being sure of tomorrow. I mean, it's heart wrenching, and I just don't know. What tomorrow might be.
Okay, so remember the last time we met, you had a homework assignment to stop every few times every day, stop and do a mental check-in. Did you try that
Yes.
exercise? Did it help somehow?
Well, for now I'm not seeing any changes, but I think that I will just continue doing the exercise, and I hope it should work.
So, are you feeling guilty over something that is not your fault?
Well, we can't be sure about what life brings, but I really believe that my lifestyle, is the cause of the way I feel as of now.
Have you thought that maybe you did not cause this sickness? Think about it.
Oh wow, I haven't thought about it like that.
So let's continue to do a daily mental check-in. And so by that, you be mindful of your here and your now, okay, and what you're doing. So remember that yesterday is gone. Whatever you did yesterday in your past is gone, and tomorrow is not here yet. So be mindful of your feeling, your thoughts, and your behavior, because how you feel, how you think affects how you feel, and then it affects how you behave. So is there anything that you like to tell me?
No, ma'am.
Okay, great. Was this helpful?
Yeah, actually,
Would you like to come
definitely.
back again for another session?
Oh, absolutely.
Okay, I'll have you down and I'll see you for the next session. Okay, and this concludes the first part of the session. So so now within section 2 of this, we'll be using the DBT modality for our patient. So, Mr. Smith, the last time you reported that you're doing better in your thought process by being mindful of your feelings, thoughts, and behavior. By doing a meta check-in, you're going to continue doing a meta check-in. So, how often do you catch yourself doing a meta check-in? Like on a daily?
Well,
Can you recall?
oh yes. I just don't sit and be checking myself all day. But when I begin to feel the signs of anxiety hitting in, that's when I go into that mental check, and it has been helping, man.
So, when thoughts are racing with anxiety, remember we talked about guided imagery, right? So, picture a stop sign. So, this is your next exercise. You picture a stop sign. Whatever, say not now. Not now, and deal with whatever it is whenever you're ready. Shut down everything. Okay? At night, shut down everything. Go to sleep. You doing, should I have, I could have, thinking it could have been better. Remember who is to say. Yesterday is gone. Whatever you did is gone. So picture the stop sign when you have racing thoughts and deal in the now. Like I said, yesterday is gone. Tomorrow is not here. So you don't want to go into tomorrow and then borrow trouble thinking what is going to happen tomorrow. Tomorrow is not here yet. So be in the here and the now. When you're having those racing thoughts, put a stop sign. Picture a stop sign and stop.
Yes, ma'am.
Okay? So would you like to come back for another session?
Absolutely, ma'am.
Okay, great. So I'll see you next month. Okay?
Thank you.
All right. So this concludes this session. Our next and final session demonstrating our last modality, ACT, acceptance and commitment therapy. So, Mr. Smith, last session we talked about, we have seen guided imagery where we are having racing, anxiety, thoughts, you just picture a stop sign and then you stop. So how did that work?
Absolutely. It's been actually working because once I have the stop sign, it actually keeps me to reflect and for me to understand that this is just life and I have to deal with it in a positive way.
Exactly. It tells your brain to stop.
Yes, ma'am.
Okay? So you stop thinking about the past and then you deal with it now. Yeah?
Exactly.
So tell me, do you still blame yourself for getting Parkinson's?
No, ma'am.
That's great. So remember, life is not fair. You're saying that maybe if you had been careful in life, things would have been different. But like, who is to say? True, life is not fair. There are people who have done worse things than you have done, smoke, drugs, and live all sorts of life, but they have not gotten diseases. Yeah, so not every disease can be explained. And so take a moment and maybe you can't, and think about where sometimes this thought is coming from, because maybe you can explain the cause. So don't judge yourself. you have done nothing so terrible that you have to blame yourself for this disease. So live for today, stay in the now, in the here and now. Like I said, the past is gone. If there's any lessons to learn from it. Come to peace with yourself. Recognize you have no control over this. Okay? Come to terms with yourself and be at peace with your disease. It's not your fault. Make the most of what you have with your family and your children. Okay? So did talking to you today help? Did it help?
Oh yes, absolutely.
Would you want me to schedule another session?
Oh please do.
Okay, great. So I will put you down for next month and I will see you in a month. So we have come to the end of our session. Thank you so much for coming,
Thank you
Mrs.
for
Smith,
having me.
and goodbye.
Thank you so much.
Thank you.
You have a wonderful day.
This last session marks the conclusion of this presentation. 3 therapy modalities were incorporated for patient optimal goals. CBT helps through mindfulness and help the patient to be mindful of his thoughts, feelings, and behavior. DBT, some level of mindfulness with guided imagery by visualizing a stop sign, helping the patient to live in the here and now. ACT assisted and help the patient to come to terms with his disease, to accept the disease progress, that he's not to be blamed and there's nothing that he could have done differently, and comes to terms with his disease and live in acceptance. And thank you so much. We have come to the end of this presentation.